Dermatology and Venereology for 8th semester students of the Faculty of Medicine. Dermatology and Venereology. Dermatology and venereology is a branch of medicine that focuses on the diagnosis, management, and treatment of diseases affecting the skin, hair, nails, and sexually transmitted diseases, STDs. In Semester 8, medical students are expected to understand various dermatological conditions and master the clinical skills needed to manage skin and venereal disorders. 1. Definition of dermatology and venereology. Dermatology and venereology is the branch of medicine that studies diseases affecting the skin, associated structures such as hair and nails, and sexually transmitted diseases, STDs. A dermatologist and venereologist are specialists who handle various skin issues, infections, and conditions that can impact appearance and body function. 2. Learning objectives of dermatology and venereology in Semester 8. In Semester 8, medical students will study dermatology and venereology with the following objectives. To understand the pathophysiology of skin and venereal diseases. To master the physical examination skills necessary for diagnosing skin diseases. To recognize various types of skin diseases, including infections, inflammatory, autoimmune diseases, and malignancies. To understand sexually transmitted diseases and how to prevent and treat them. To plan appropriate treatment and interventions based on clinical diagnoses. 3. Scope of dermatology and venereology. 3.1. Skin diseases, skin infections, impetigo. A superficial skin infection caused by Staphylococcus or Streptococcus bacteria. Furunculosis and carbunculosis. Infection of hair follicles that causes swelling and abscess formation. Cellulitis. An infection of the skin's deeper layers, causing inflammation, redness, and pain. Tinea, fungal skin infections, fungal infections that cause ring-shaped rashes, such as tinea corporis, body, or tinea pedis, feet. Inflammatory skin diseases. Atopic dermatitis, a chronic inflammatory skin disease that causes itchy rashes. Typically seen in children and sometimes persists into adulthood. Psoriasis, an autoimmune condition that causes thick, red, and scaly skin patches, usually on elbows, knees, and the scalp. Eczema, skin inflammation causing itching, redness, and rashes, often triggered by allergies or irritation. Autoimmune skin diseases, systemic lupus erythematosus, an autoimmune disease that can affect the skin, causing a butterfly-shaped rash on the face and lesions on other body parts. Vitiligo, loss of skin pigmentation that leads to white patches on the skin, caused by immune system dysfunction. Skin malignancies, basal cell carcinoma, the most common type of skin cancer. which is slow-growing and rarely metastasizes, often presenting as a small, slow-developing nodule. Squamous cell carcinoma, a more aggressive skin cancer than basal cell carcinoma that can spread to other organs. Melanoma, the most dangerous form of skin cancer, often developing in existing moles or lesions. 3.2. Sexually transmitted diseases, STDs, sexually transmitted infections, syphilis, caused by the bacterium Treponema pallidum, presenting with initial sores or ulcers in genital, oral, or anal areas, followed by a rash on the body. Gonorrhea, caused by Neisseria gonorrhoeae, leading to infections in the genital, urethral, rectal, and throat areas, often resulting in purulent discharge and painful urination. Genital herpes, caused by herpes simplex virus, HSV, leading to recurrent lesions on the genital area with pain and itching. Chlamydia, a bacterial infection that is often asymptomatic but can lead to serious complications if untreated, such as infertility in women. Other skin conditions associated with sexual activity. Human papillomavirus, HPV, a viral infection that can cause genital warts or cervical cancer in women. Pubic lice, pediculosis pubis, an infestation of pubic lice, leading to itching in the genital area. 4. Learning components. Theory. Lectures on the pathophysiology of skin and venereal diseases, causes, symptoms, and treatments. Review of the latest literature on the management of skin and venereal diseases. Discussions of various types of skin infections, autoimmune diseases, and skin malignancies. Practical. Comprehensive physical examination of the skin and genital areas. Microscopic examination to diagnose skin infections or venereal diseases. Simulated treatment and care for various skin and venereal diseases. 5. Assessment of learning. Theory exams, assessing students' understanding of the pathophysiology, diagnosis, and treatment of skin and venereal diseases. Practical and skills assessment. Students are evaluated on their ability to perform physical examinations and manage patients with dermatological and venereal disorders. Case discussions. Discussions on cases of patients with skin or venereal diseases, requiring accurate diagnosis and appropriate therapy. By studying dermatology and venereology in semester 8, medical students are expected to gain knowledge and skills in diagnosing and managing skin and venereal diseases and providing appropriate treatment for patients.